con nuestra última panelista. Ella nos acompaña desde Finlandia. Ella es Annukka Isokoski. Ella es profesora titular de la Universidad de Ciencias Aplicadas en Tampere, Finlandia. Vamos a escuchar su mensaje.
So, welcome everybody. Thank you for this opportunity to participate your Congress, and thank you for University of Aguascalientes for this invitation. My name is Annukka Isokoski. I'm from Finland, and I'm a lecturer in nursing degree program in Tampere University of Applied Sciences. And I will tell you something about the working conditions and academic training of nurses in Finland. So first, a few words about Finland. We are there in the north of Europe, next to Sweden, and we have quite a small population, 5.5 million, compared to the land. So we are quite scarcely populated country, which brings own challenges to the nursing care as well, when we have aging population and long distances. Many families live apart and are not in the care daily for many of the elderly people. There in the map you see that more than half of the country is populated with 10 or less people per square kilometer. So we are quite far from each other often. This is how it looks like now at the late autumn. A lot of forest and a lot of lakes. Nurses in Finland, we are quite many compared to the population. We have the highest number in Europe of nurses per 100,000 people. And compared to doctors, we are 4.6 nurses for each doctor, which means that nurses do have a big role in healthcare services and providing the treatment and care the people need. We have practical nurses and registered nurses of bachelor level, and then in university you can study nursing science for master's level or even higher above. With this master's degree, you either can be a teacher like me, or a head of a department, or in the leadership position in the hospital. And the daily nursing care is provided through practical nurses and registered nurses. They work in primary health care, specialized care, also outpatient care in both sectors or levels, and home care, and also these elderly homes, and then some third sector associations and so on. We have quite large and strong public health care in Finland, and it provides most of the health services in Finland. It's funded through taxes, so the user fees are quite minimal, and it employs about 3/4 of all the healthcare personnel. The working conditions in Finland, I think the working conditions in hospital, like I said, nurses have a big role and big responsibility in healthcare, and the roles between doctors and nurses are quite interlinked, and many of the tasks that have been traditionally performed by doctors are nowadays also transferred to nurses. For example, nurses, for now about 10 years, we have had this limited prescription rights certain medications that nurses can prescribe if they have the specialization training for that. So one example about this task shift that is happening here. Also, the shifts that have been quite big is that computer plays bigger and bigger role for both self-care and guidance of the patients. Our patient records are all online, and the patients can access them. Also the doctor's appointments are reserved online, and lab results and so on are available online for the patient. And this also brings challenges for the nurses with the patients who don't have access or don't have the capacity to use all these online services. So nurses do need the knowledge and guidance skills for those patients. Another shift in working conditions is that often the work environment is the home of the patient. So a lot of services are brought to homes, even hospital level, intravenous infusions and so on are brought to the home of the patient, and it's cost effective and often quite convenient for the patient as well. But it does bring certain issues to the working conditions when you are at somebody else's home and not in the hospital environment. Also, the technology is a big part of healthcare services and nursing in Finland, and becoming more and more so. Some of the home care visits are done virtually and online. Also, doctor's appointments in some parts of the Finland are done online if the patient's condition is suitable for that. Well, in many cases, the patient does not need to travel long for the checkup, but the nurse or doctor can visit them through these online services. There's an example of this lunch club that the elderly people have together with the nurse, and at the same time the nurse can check that the medication of the lunchtime is taken, and that everybody remember to eat, and often the socialization makes it more attractive for the elderly. Also, many people at home, they do have security buttons, for example, to call help. Just like in hospitals, they would have a bell to ring the nurse. At home also, they get contact to the nurse through pressing a button. So if an elderly person is, for example, fallen in the home and living alone, they can call help. Here's an example of this online patient record I mentioned. This is from my own, so I can check my recipes here. I don't need a paper for going to pharmacy. I can check my lab results or the doctor's texts from my last visits and so on. A few words about this degree program in nursing. It takes 3.5 years, and it's 210 credits. 1 credit meaning 27 hours of study. This unit is used throughout Europe in the studies. To get in, you need to take an entrance exam, and for that, the person should have either this practical nurse training from before or matricular examination, meaning upper secondary school. And these 3.5 years, it does include supervised training in hospital settings and also in the school settings, simulation and so on, for 75 credits. And the bachelor thesis is 15 credits work. There are EU standards throughout Europe to standardize the nursing education, the length and the content and so on. And for example, these professional competencies of registered nurses are agreed nationally, but also in EU level. And we are actually developing a standardized exam for the whole country for different universities of applied sciences, so that the nurses graduating are tested, their skills and competencies are tested with the same exam. Some new waves of future we are preparing our students to graduate to. We have this virtual lab of social and healthcare that is developing and investigating technological solutions for health and well-being. Those that are existing or coming, but also new ones, new ideas. And this is one benefit of a big university, that we have a lot of training programs in engineering and in technical side, but then also this strong knowledge and skills from the health and well-being side. Another aspect that is developed at the moment and paid much attention in the developing of nursing care and nursing education is genetics and genetic information that is more and more available for common people, common patients, and we get more and more information about the links between genetics and our health and for example use of medication or and so on. So that's something that is included in our nursing education. We are also really happy to cooperate with you in University of Aguascalientes and for other universities from Latin America in this starting project of Smart Nurse, with the aim of developing competencies of nursing students in digital nursing and health promotion. And we're starting this project at the end of this year for the next 3 years. And I think we can all agree that within this pandemic, it's really actual and useful project to come. It does have two sister projects here in Europe and also in Asia, with a little bit different twist in each, but we are linking each other to this international network. I'm so glad to work with you and glad to be here together with you. Muchas gracias.
Gracias por su participación, maestra Annukka Isokoski. Bien, vamos a